Understanding why people actually use healthcare services, it's not just academically interesting, right? It's vital.
Absolutely vital. For planning, for resource allocation.
Yeah.
I mean, where do you put the money, the effort?
Who needs the help most? It's a complex web.
Incredibly complex.
Yeah.
Too many factors shape those decisions.
And that complexity is exactly what we're getting into today. We're doing a deep dive, looking at some really interesting research using machine learning to try and predict healthcare demand.
Right. And our source here is a paper analyzing data from the 2022 Türkiye Health Survey. So quite recent, quite comprehensive data.
A big national snapshot. And their goal, which we're kind of adopting for this deep dive, was using these advanced methods
Machine learning, yeah.
to really zero in on the key things driving healthcare use. And they framed it using Andersen's behavioral model.
Which is a really helpful way to think about it. It sorts influences into 3 buckets, basically.
Okay, what are those?
You've got predisposing factors, this is sort of who you are, age, gender, your background. Then enabling factors like what resources you have access to, income, insurance, maybe where you live. And finally, need factors. So your actual health status, chronic conditions, how healthy you feel.
Predisposing, enabling need. Okay, let's unpack this.
So the researchers used some pretty sophisticated machine learning models. Things like random forest, XGBoost, gradient boosting.
Think of them like super detectives sifting through all that survey data.
Exactly. They're designed to find patterns, even really complex ones, that link all these different factors to whether someone actually sought health care.
And were they effective, these models?
Oh, very. Especially XGBoost and gradient boosting. They did a good job identifying the strong predictors.
Okay, so what did these data detectives find? Let's start with those predisposing factors, the who you are stuff.
Well, maybe not surprisingly, things like gender, education level, and age group were significant.
Right.
The study confirmed, for example, that women generally tend to use healthcare services more often. And older age groups, naturally, and also having less formal education, were linked to higher use too.
That makes intuitive sense. Older age often means more health needs. What about enabling factors? The resources, the access?
Yeah, this is where it gets really interesting, I think. The models highlighted some specific barriers.
Such as?
Things like the out-of-pocket costs people face. And specifically, difficulty paying for dental care or mental health services. That really stood out.
Wow. Okay, so the financial friction is key, especially for dental and mental health. Anything else?
Yeah, interestingly, something they termed community interest or support seemed to matter, alongside the more expected things like delays getting appointments or transport problems.
Community interest. So your social environment plays a role too. What about the need factors, the actual health issues?
This was maybe the most striking part. Smoking status came up as a really strong predictor, like consistently important across the models.
Smoking.
And of course, having chronic diseases, they've specifically mentioned things like depression, neck and lower back problems, hypertension. Those were major drivers.
Right, the big ones.
And also, simply how someone perceives their own overall health, that subjective feeling matters.
So smoking being right up there, that's powerful. And depression, those musculoskeletal issues, pinpointing specific conditions, did they look at everything together?
They did. They ran an integrated model, putting all the factors in the mix, and the top predictors that emerged. Smoking status again, gender, that community interest factor, overall perceived health status, and crucially, payment difficulties specifically for mental health care.
It really paints a picture, doesn't it? How it's all interconnected, who you are, your resources, your community, your specific health needs.
Exactly. It's not one single thing. And the research points towards some pretty clear policy implications from this.
Like what, based on these findings?
Well, directly addressing those cost barriers, particularly for dental and mental health, seems crucial. Also, things like strengthening smoking cessation efforts, given how predictive smoking was.
Makes sense.
And finding better ways to manage those common chronic conditions, depression, back pain, that drive so much demand. These aren't just numbers. They suggest real-world interventions.
So what does this all mean?
I think this deep dive shows us, using some pretty advanced tools, that predicting healthcare demand isn't simple. It's this mix of personal factors, money, access, community, and actual health.
And the machine learning really helped weigh those factors, didn't it? Highlighting things like community support or the specific pain points around mental health costs.
Precisely. Understanding these specific drivers, backed by the data, is just so important if you want to build healthcare systems that actually work well and are fair.
Yeah, it makes you think, doesn't it? How these factors, which seem pretty universal, might look different in, say, the US versus the UK versus Turkey, and that constant tension between, individual choices and the system's barriers or supports.